So uh, quickly we'll start with we'll play a little quiz. You just have to tell me whether it is a fact or fiction. So first question or statement is postnatal yoga can help improve pelvic floor strength. It's a fact or fiction?
Fact.
Correct. Breastfeeding mother should avoid yoga to prevent milk supply issues. Fact or fiction?
Fiction.
Yes, correct. It's safe to start postnatal yoga the day after giving birth. Fact or fiction?
Fiction.
Again, fiction.
Fiction.
Correct. Postnatal yoga should be avoided if mother had a cesarean birth. So again, it's a fiction. Okay. So Sutika means a woman in postnatal stage, and Sutika Paricharya means a holistic postpartum care. Why Sutika Paricharya is important? For the faster recovery and healing. It also pacifies Vata and Kapha dosha to avoid various postnatal complications, to boost physical, physiological, mental, and spiritual well-being, to educate and support new mother to nourish her baby, to educate and support mother, thereby prevent neonatal health-related risks. So first of all, we need to, give importance to the counseling. So mother should be ready for the postpartum exercise session as well as for breastfeeding. That to be, it should be by choice. So health promotion, prevention is always better than cure. So she can talk, or newly mother can talk with healthcare professional or her family members who are definitely, experienced. Then in diet, she should have healthy balanced diet, warm food, appropriate lifestyle, fluid intake 3 to 4 liter per day, iron rich food, high carbohydrates and protein rich diet. She should avoid having fried, spicy, stale and packaged food. In Ayurveda, there are certain medicines which female can definitely consume. For digestion, she can have Panchakul churna with ghee, jaggery or oil. Then jaggery water in 1:4 ratio. That means 1 part of jaggery and 4 part of hot water or lukewarm water for cleansing womb. Then galactogoggle, shatavari, fenugreek, fennel seeds, garlic, ragi, milk and almonds. They can be, helpful for milk secretion. Protective lifestyle can be achieved by wrapping abdomen, which helps in reduce vata, involution of uterus, regaining abdominal muscle tone, warm clothing, isolation, which will prevent her mother as well as her baby from infections, warm water bath, rest, and yoga. But initial days, only breathing and yoga nidra is advisable. Ayurveda therapy, female can go for Abhyanga, Ayurvedic massage with sesame oil in winter and coconut oil in summer. Dhupan Ayurveda fumigation with herbal formulations for the genitals, and Sweden generating body sweat by heating methods. So sweating can be considered as one of the excretory system. So we can remove all the toxins. Breast care, one of the important point. Okay, so we should encourage female breastfeeding as early as possible after childbirth, particularly within 2 hours, first 2 hours after childbirth. Educate about the hygiene of the breast. Ask her not to use any soap or liquids. The smell of milk is important for baby as it navigates baby to the nipple. Inverted nipples or flat nipples, they are there. If you then you can check for the nipple pinch test. It's a simple clinical test, okay, from which you can find out whether females nipples are ready for the breastfeeding or not. It will definitely help female for the, as well as for the baby to have proper latching. If there are cracked nipples, soreness or painful breast, then we need to teach her proper latching technique. In this image you can see the breathing is not obstructed and baby has covered entire nipple and areola. Whenever you get a chance, please encourage or educate female about the breast cancer screening. She can palpate her breast at least once in a month. And if she is finding any lumps, they're increasing size or in numbers, then she should immediately visit gynecologist. If she is having any of the condition like breast engorgement or mastitis, then immediately ask her to the refer gynecologist or a physiotherapist. Genital hygiene very important. Although female is having normal delivery, but there are chances of episiotomy suture. In the image you can see episiotomy suture. For that you can give yoni dhoop, yoni lepan, yoni pichu or yoni sweda. This will help healing faster her sutures, and it will make her sutures more mobile and pliable. Avoid using of any chemical or antiseptic creams. Postnatal yoga and health, the delivery can be divided into vaginal and cesarean section. Importance should be given to the posture because females body undergo tremendous changes during pregnancy. So posture correction exercises should be taught. In ma'am's book, all these asanas are given, the general asanas. So for 4 days, the female should rest, and then progression after every 15 days can be made. Please include Lom Vilom, Brahmari, Ujjayi, Surya Vedan, mantra chanting, prayer, pranayama, and Omkar chanting in cool down phase. In cesarean section, we need to focus or emphasis more onto the relaxation. We can give Sukshma Vayam, Pranayama, and meditation. According to the FIT principles, ACSM guidelines, aerobic exercises can be given after 4 to 6 weeks for normal vaginal delivery and after 8 to 10 weeks for cesarean section. So these are the dosages which we can consider. Uh, Also, we need to focus, if you're prescribing any exercise or asanas, we need to focus on breathing awareness, pelvic floor strengthening, and tailor-made exercises as per the specific postpartum condition. Thank you. I would like to thank ma'am, Nitin ma'am, and Maya ma'am, and all my co-participants for their inputs and teaching me a lot of things. Thank you.